Let's begin with Wilson Walker on a new testing strategy in Santa Clara County. Wilson?
Well, look, we've been talking about the soaring number of cases in this county, the pressure that is putting on the hospitals. Well, today, Santa Clara went back to the basics, and yes, that is testing, testing, testing.
We have significantly expanded our testing capacity. We have seen an increased need of people coming out, needing to come out to get tested. So we increased to 5,000 people a day is what we are capable of doing right now.
It is full throttle at the fairgrounds, where part of the challenge now is preventing backups on site. And as of today, there is an emergency testing intervention off-site.
Going door to door, the promotoras will offer self-administered COVID testing to individuals in the household.
The county is partnering with neighborhood health workers to personally hand out tests in hard-hit areas of East San Jose, where language barriers and fear have stood in the way of testing access.
The plan is to canvass the areas before arriving, so families know to expect us, that this is a legitimate service.
Back at the fairgrounds, a reminder that an appointment is necessary, in part to keep this operation working at capacity.
It very much slows us down if you don't have an appointment, and it prevents us from testing the number of people that we could otherwise test if we had somebody, if everybody came with an appointment.
Okay, let's talk about hospital numbers. As we have been predicting and saying was likely, ICU numbers will wobble around day to day, even hour to hour. That happened. Now, before we show you the numbers, I want to say that I talked to Regional today, one of the hospitals at capacity. They say they're at the same spot. They are full. They have discharged a bunch of folks who feel better, and just as quickly they brought some in. So how did the county numbers change? Let's look at the numbers here. You are looking at the last 30 days of ICU capacity in the county. You can see it trending downward. And then it jumped up yesterday, those were the Wednesday numbers, by about 14 beds. What happened there? Well, look at the breakdown of the numbers. The blue at the top of those lines, that is available beds. Everything below is a patient, either gray, which is a non-COVID patient, or orange, that surging line, those are the COVID patients. The only thing that changed yesterday is the available beds. So why did the ICU availability change yesterday? They found more beds. It is as simple as that. So Regional's still full. What do you think is going on at Regional's partner hospital? Well, we can show you that. That is Good Samaritan Hospital, which really isn't all that far away. Well, they're putting up the tent that they took down back in April when they thought they might not need it. They are seeing a steady increase of COVID patients there, although they still have the fewest of any hospital in the county. But yeah, they're making preparations in case they need more space, have to do some testing in that tent. So you can see a lot of things are changing here. Remember, testing is not just about keeping yourself safe, keeping your family safe, keeping your coworkers safe. Testing is like intelligence. It's like having a bug in the phone that tells you what's coming to the hospitals 10 days away. So that is why they are redoubling their efforts here. Live in San Jose, Wilson Walker, KPIX 5.